Perfect. So hopefully you guys can all see the presentation. Thanks Iris for the intro, and thank you all guys all for coming. As Iris said, so my name is Claire. I'm currently a doctor working in the UK, and I've been doing some work with the Alliance recently, and also used to be a rider myself as well. So the idea of this presentation really is to go through the UCI guidance that they've produced on returning to racing following the Covid-19 pandemic. And we really want to highlight the kind of key facts that you guys need to know as riders. So the guidelines themselves basically give an outline as to how they want to resume racing safely following COVID-19. They go through all the different kind of infection risk levels, and according to those risk levels, the kind of mandatory, recommended and desired protocols that they want the organisers and teams to put in place, depending on how high the risk levels are. Those protocols are either generally the race organisations or teams, or sometimes even UCI to put in place. I think I just wanted to take a moment to really kind of highlight why it's important. Why have we got these guidelines? What's the point in them? And I don't think I can really kind of convey enough just how much risk there is involved in racing and returning to racing following the pandemic. You guys are flying in or driving in from multiple different countries, all with different kind of levels of risk. Coming together and then racing together in the peloton, spending hours at a time together, all in close confinement. I think I also want to say athletes are not immune to COVID-19. As a doctor, it's been particularly tough seeing young, fit, healthy people ending up in ITU with this disease. It can be devastating, even for young, fit, healthy people. And I think alongside that, we're now recognising as medics the risk of long-term, potentially career-ending illness for athletes as a result of COVID-19. So 1 in 4 symptomatic people with COVID-19 will end up with heart complications as a result. And for you guys as athletes, that could mean the end of your career. And I think, it's again highlighting that risk to family, friends, other teammates, other members of staff. So your actions really matter in this, and upholding these guidelines as well. I think the good thing is that, the guidance does offer a good chance of returning to racing safely. It does offer some really good advice on how we can kind of mitigate the risk. And we'll go through some extra advice as to kind of what you and your teams can do on top of that to kind of stay safe. But I think, again, it's just really reminding you that you have to follow the guidance. You have to take it seriously. As pro riders, you've all got fantastic discipline when it comes to your training, racing. Please bring that to upholding these guidelines. Please bring that to making races safe. One race is not worth endangering yourself or others when it comes to this. So when is racing going to start again? And I think after a bit of a bumpy last 24 hours, we have seen the first race of the season start again, which is good. So according to the UCI, they outline the kind of phases of the pandemic, so the different kind of risk levels at which racing can take place. And actually, you can see there that it's only really at the very highest levels that racing can't take place. And so a lot of countries now are kind of in that post-peak phase. So there is that kind of possibility of recurrence and kind of returning back to a pandemic phase, or going back to that kind of phase 4 as well. And again, it's worth, different countries will be in slightly different phases. And according to the phase, the race organiser must then have sufficient mitigations in place, depending on that risk level. And this table, again, just goes into a bit more detail about those different phases and what the UCI kind of dictate that the corresponding risk level is. And again, the higher the risk level, the more mitigations the organiser must take. We don't currently know exactly what those are, but we're hopeful once the UCI have got their platform in place, organisers can then upload their risk assessments and we'll be able to see a lot more as to what exactly they're doing to reduce the risks for you guys. I think it's worth noting, so currently in the Navarra region at the moment where the race is taking place, cases are actually now up to, I think it's just over 70 new cases per 100,000 population per week, with an R value of just over 2. So how exactly are we going to resume racing safely? There's a whole combination of things. I think one of the key things to it in all of it is the health screening, which is a combination of both swab tests and symptom questionnaires that have to be done by all athletes, staff and the race organisation, so anyone that's coming to the race. And on completing that health screening, so if you have negative health screening, then you can then join what they call protective bubbles. So whether that's your team bubble and then the peloton bubble. And anyone else from the race should be in their own separate bubbles. That's the organisers, media, anyone else attending the race.
Claire, one more thing.
Yeah.
Sorry again, but I cannot let people in again who are too late. So could you let participants in that are waiting in the waiting room? Sorry.
No, adding people in. Is there a way to see who's waiting?
It says participants and then there should be a waiting room.
Oh, cool.
To admit them. Of course, the Dutchies who are too late, so.
Yeah, I can't find it actually.
Okay, wait 1 second then. No, I can't see it either, so.
Cool. Yeah, we'll just carry on. Sorry, it's just the menus now. Okay, cool, right. So, yeah, going back. So, as I've said, the key things include the health screening, the formation of protective bubbles, so your team and the peloton, providing that health screening is negative. And then alongside that, I think imperative to it is also the principle of social distancing. So the UCI mandates a minimum of 1.5 metres between people at all times, apart from during racing. I think it's being aware that there may be slight differences depending on which country you're racing in. So just being aware of that country's guidelines. And then alongside that, protective equipment. So masks for travel, you know, when you're walking through the hotel, when you're on the podium. Again, being aware of your country's guidelines that you're racing in. And then just good practices by yourselves as individuals, by your teams, by the organisers. And that's things like washing hands, regular cleaning, disinfecting, you know, again, maintaining that idea of social distancing, wearing masks when you're out and about, and even things like being mindful of your social bubbles at home. So the guidelines kind of go through all these different actions, and we can break them down quite nicely. So things to be done before racing, during racing, and then after racing. Organisers are predominantly responsible actually for putting most of the guidelines into action. However, teams play a really important role in the health screening side of things. And whether certain protocols are mandatory or not, as I've said before, will depend on the risk level. I think it's also being really aware of the country that you're in. So different countries may have slightly different protocols regarding social distancing, wearing a mask, the kind of testing and tracing or self-isolating. They may be more strict than the UCI guidance, and our advice is to follow whichever is more strict. So it's just being aware of where you are and what that country's guidance is as well. So what exactly do you need to know as a rider? What are the kind of real key points? So in the run up to racing, I think it's worth being aware that your team has to have kind of certain what they call prevention procedures in place. And so this applies to all staff and riders. And it's things like making sure your team has got a good supply of appropriate protective equipment. So things like masks for travelling or when you're not able to socially distance. Things like gloves for the mechanics and soigneurs when they're handling bikes, handling food. If a soigneur is going to do food preparation, they should be wearing gloves and a mask. Having a good supply of hand sanitizer for when soap and water isn't available to wash your hands. And again, a good supply of disinfectant and wipes for kind of cleaning any commonly touched surfaces and team vehicles. Other things to maybe consider would be like a thermometer for the temperature checks, and kind of high standard face mask, gloves, eye protection and gown if a rider or staff does have suspected or proven COVID-19. And alongside that, your team should have some good set out protocols for kind of cleaning of technical equipment, and again the kind of appropriate cleaning and disinfection of things like camper vans, team vehicles, any other kind of commonly used equipment. In the meantime, the organiser themselves need to appoint a COVID-19 doctor for the race. So that's a dedicated doctor who will handle any kind of COVID-19 cases during the race, and also look at the risk levels and kind of local health situation. Organisers need to provide appropriate accommodation, so that should be a single floor or wing for your team. Your team should have an isolation room, so somewhere that a rider can go if they're suspected of or have proven COVID-19 during a race. And every team should have their own dining room, so there should be no shared dining facilities. The organiser is also responsible for sharing their risk assessment, which should set out what the risk levels are, what mitigation measures they're putting in place, and how they will manage a COVID-19 case should that arise during a race. And that should be done through the UCI protocol, which we know isn't platform, which we know isn't up and running at the moment. And it should be done 2 weeks before a race. So all teams should have that information 2 weeks before a race. So immediately before races, if we first cover one-day races, there are two kind of key things that you guys need to make sure you get done. So one is the COVID-19 Symptom Questionnaire, which you have to do every day for the 5 days before the race. And that's all riders and staff. And if you show any symptoms, that effectively will mean no racing and you should be referred for a swab test. And your team is responsible for conducting that questionnaire and checking the results. And what the UCI now have kind of clarified is that actually it should be a doctor who is checking that questionnaire and going through the results. On top of that, you also need a swab test. For Women's World Tour races, that should be done both 6 days and 3 days before the race. For the UCI first and second class races, it's just 3 days before the race. And again, it applies to all riders and staff, and your team is the one responsible for this. And again, the UCI have clarified that actually it should be a doctor that's signing off the results for these tests. For stage races, it's pretty similar. Again, you have, so for the Women's World Tour race, you have a swab 6 and 3 days before the race starts. And again, you do your daily symptom questionnaire for at least the 5 days before. For the class 1 and 2 races, again, it's just that single swab 3 days before the race. if all of that is negative and it's all been signed off by a doctor, you can then join the peloton bubble. And again, it's for all riders and staff, and it's your team that's responsible for organising and getting all of that in place. Just a quick, so this is the symptom questionnaire that the UCI kind of have provided in their guidance. And it kind of goes through a scoring system, and depending on your score, you either consider being referred for that swab test or you must get a swab test. I think the caveat to that is, kind of having spoken to a couple of the other team doctors, that actually our recommendation is if you display any of those symptoms, you should self-isolate, you should seek medical advice from a doctor, and you should potentially be tested for COVID-19. So actually our kind of recommended advice is that not to use a scoring system, but to go based on displaying any of those symptoms that they list. Immediately before a race, so again, organisers should provide you with information on the use of any kind of protective equipment, so when they expect you to wear masks. Also making sure that, again, the media, officials, the VIPs, they are all kept separate from the riders and that peloton bubble. They should make sure that any communal areas, it is possible to social distance, and that they're regularly cleaned and disinfected. Interestingly, the UCI has advised against the use of changing rooms. So again, it's just as a rider being aware that the organisers may or not provide changing rooms at races. So just having that in the back of your mind. During one-day races, as a team, on the morning of the race, you need to make sure you complete a COVID-19 symptom questionnaire. And again, it comes down to the responsibility of a team doctor to check that, make sure you're not displaying any symptoms and that you're okay to race. As an organiser, you should expect them to have changed the kind of sign-on and registration. Again, so you're able to socially distance, there's no kind of physical contact, you're not signing any bits of paper or not handing a pen around to sign on. And feed zones, again, should be made possible for soigneurs to be able to feed athletes and maintain that kind of social distancing. And it's the same for stage races. I think the only slight difference is for the Women's World Tour races, it might be that you're asked to complete the symptom questionnaire morning and evening, so twice a day. They also mention, so the guidance also suggests that organisers should consider doing swab testing during the race. So that's something for the organiser to arrange. But at the moment, it looks like that is probably only going to be implemented for the Grand Tours only. So it's kind of not clear whether or not that will happen within women's races. And the COVID-19 doctor is the person who's responsible for managing any suspected cases. So that's the doctor provided by the organiser. And then after the race, if you end up on the podium or winning a jersey, it might be that actually you have to self-serve, so pick up your own trophy, pick up your own jersey. There should be no physical contact, either with organisers or other athletes. You should wear a mask. And again, the organiser should have limited crowd size and any media. In terms of anti-doping, they have actually now released some guidance. And again, it all kind of comes back to this idea of being able to socially distance if you get called up for anti-doping, wearing a mask, and again, good kind of cleaning and disinfecting. I think the main thing to point out for athletes is that if a race is happening in a moderate risk level, it might be that there are no chaperones, they don't provide chaperones. So I think it's just really important, if there are no chaperones coming to pick you up for anti-doping after a race, just remember to check yourself that you've not been called for anti-doping, because there might not be someone to remind you. For multiple races, and again, kind of coming back to the testing and how it works if you're doing kind of multiple races back to back. So one swab test is valid for up to 10 days. So if you've got, and hopefully the diagrams kind of illustrate that quite nicely. But if you've got multiple races, so multiple one-day races happening within that space of 10 days after the swab test, then you don't need any further testing during that 10 days. As soon as a race falls more than 14 days apart from that initial swab test, you then have to go through the same process. So have your swab testing 3 days and 6 for a Women's World Tour race before the next race. And for stage races, they actually state, so you have to repeat the swab testing before the race, before that stage race, even if it falls within 10 days of a one-day race. The only exception to that is if you're doing 2 lots of testing and a one-day race kind of falls in between those 2 tests. But again, hopefully those diagrams explain that quite nicely. I think the other thing to say is that yesterday, again, the UCI kind of confirmed there is some flexibility in terms of timings of tests. So in fact, you know, when they say 6 days, it's kind of 5 to 7 days, and 3 days is kind of 2 to 4 days. And they have said that they would accept kind of results coming in on the morning of a race. I think it's important, though, you know, you've got to be organised about it. And I think, again, it comes down to, you know, the practicalities of organising these tests, particularly on the road, can be quite hard. So when we went through these guidelines, I think our main question is, you know, are they good enough? And actually, we had quite a lot of questions that arose as a result of kind of going through them all. And I think, you know, a lot of teams and riders have had similar questions. We have put these questions to the UCI and have had some good responses on some of them. I think, again, one of the ones to highlight really is about teams not having doctors. And I think yesterday the UCI did kind of really clarify that they expect teams now to have doctors to be able to check those swab results and the questionnaire results. When it comes to, so I think one of the questions we had was about riders who potentially have, who are at higher risk of COVID-19. Either they're at higher risk of catching it or higher risk of having kind of more serious outcomes. And actually, you know, should they be made to race in higher risk countries? And our feeling is that, you know, if you feel that within your team there's an athlete who is at greater risk, that should be discussed again with a medical practitioner, and they should have the option of not racing without consequence if that's felt to be an issue. I think there's still a lot of questions as to how testing is really going to work, particularly on the road, you know, and the logistics and the kind of financial implications of testing. Yeah, and I think a lot of the questions will improve once we've got the UCI, once we see that the UCI have got their platform up and running, and things like we'll be able to see organisers' risk assessments and exactly what they've got in place to kind of make races safer. So yeah, a few things that we've kind of been doing about the concerns that have been raised either by yourselves or, you know, just from us kind of looking through the guidance. So as I said, we've raised a lot of these concerns with the UCI already, and hopefully we can answer some of your questions if you have any today. We've been working with kind of with different teams and their medical staff, so in particular Tessa, who's here today from CCC Live. And the idea is to produce a working document that teams can use as guidance, that kind of really, again, just picks out the key points and kind of some extra bits and pieces that you can do to help make races safer. I think the other thing that's kind of come up in the past few days is that the idea of making a traffic light system to rate race safety. So you as teams can have a look and see that actually, yes, this race organiser has uploaded their risk assessment. They are meeting all the kind of protocols that the UCI have set out. Riders are completing the testing as required, and the overall risk levels in that region is low. So actually, yes, that's a really safe race, and that's a good one to go to. Or, you know, on the other hand, an organiser hasn't, you know, put in place any mitigations, and they haven't shown evidence that they're meeting the protocols, you know, and actually the situation in that region isn't great, and perhaps that's a race to consider not going to. And I think the other thing that I'm really looking towards doing, and potentially running another webinar on, is providing a bit more guidance on returning to training and racing if you are infected with COVID-19. I think, as I've already said, it can have some pretty significant side effects and some significant consequences as an athlete. And so that's something we're kind of really keen to give a bit more kind of information on. I think there's a few other things that you probably should consider outside of the UCI guidance. So again, there's been a lot of things coming up in the last week, one of which is the fact that organisers or national federations may in fact ask for a declaration that riders are coming from a low risk area. It's not clear who will give that declaration or who can make such a declaration, you know, and whether that's something that will become a factor as kind of racing progresses. The guidance itself has been changing at least on a weekly, if not daily basis. So I think staying up to date with it is really important, being aware of any changes that the UCI is making. Be really aware of the guidelines of the country in which you're racing. I think I've said this already, but it may be that they're more strict than the UCI's. So it's just being aware of that. I think it's important also just to check your own country's guidelines on quarantine after travel when returning home. So I know in the UK, they have a list of countries that are either exempt, or if you come back from certain countries, you have to quarantine for 14 days afterwards. So it just may impact on your racing and then travel schedule kind of subsequently. So it's worth being aware of that. And also as riders, you know, we're quite aware that a lot of riders will provide their own health and travel insurance. So just make sure that insurance actually covers you in the event of either getting COVID-19 in a country or at a race, or if you end up having to self-isolate for 14 days because someone else has tested positive at a race, make sure that your travel insurance will cover you for that. So the final thing really is just to run through a few points on what else your team can and you can do to kind of, again, help maintain that safety. And hopefully a lot of this is common sense. I think a lot of countries have put a lot of work into kind of promoting these ideas, but I think it's really important that we get into the habit of doing these things and just being a bit more self-aware of all these different things that could potentially help. So I think starting with just general personal hygiene, so the really obvious things like washing your hands with soap, which should be done for at least 20 seconds with good technique. You know, after you've coughed or sneezed, after you've been out shopping, any of those things. Avoiding touching your face, eyes, nose or mouth. Again, particularly when you're out and about, if you're traveling, just being self-aware that you're not doing that. Using tissues to kind of catch any coughs or sneezes and immediately throwing them away. Keeping your nails short. Again, good kind of disinfection and cleaning of any regularly or commonly touched objects or surfaces. Wearing a mask, which I think is now becoming increasingly kind of mandated in many countries, particularly when you're out in public areas. And yeah, just being mindful again, if there are no changing rooms at a race, just thinking about what you're going to do immediately after races in terms of cleaning up and that sort of things. When you're travelling, making sure you've got a mask and carrying hand sanitizer at your own at all times, making sure you've got your own hand sanitizer, so not sharing it around between teammates, and travelling by car when possible, avoiding any queues, and again, if you're on public transport, avoiding those kind of commonly touched surfaces, and taking your own food and drink, or even buying kind of, if you're going to buy something that's sealed in kind of bottles or packets, not something that's been handled by someone else. And sitting in an aisle seat away from the toilets has also been shown to kind of reduce the risk of respiratory infection when you're travelling on a plane. Maintaining good ventilation when you're in a car altogether, and even something like bringing your own pillowcase to a race. In terms of team equipment, again, it's just getting into that habit of before and after use, making sure you're regularly cleaning and disinfecting any kind of shared items any travel vehicles, your camper van, making sure any food preparation for the team is done hygienically, wearing a mask and gloves. Our advice is actually, massage is not a medical necessity, and we should be looking to reduce the frequency of that. And whilst you're having massage, making sure you're both wearing a mask, both using, washing your hands, good hand hygiene. And similarly with mechanics, making sure that they're using gloves, having good hand hygiene, wiping down bikes when they've been handling them. And then I guess, a final few kind of common sense points, but, when you're racing and in this race period, it's just being mindful about your own social bubble at home, or, when you're on the road. I think avoiding crowds and parties, being careful about, do I really need to meet that friend for coffee, in the middle of this race block, or actually can it wait until after racing? And considering training alone rather than in big groups. And in terms of just general kind of management of sickness, again, getting into the habit of not just in those 5 days before races, but actually every day, going through that symptom check, doing a daily temperature. If someone is sick, making sure you're avoiding them. And if you yourself get sick, make sure that you self-isolate, tell your own doctor, and then seek testing if appropriate. And follow your own country's guidelines about kind of isolation testing and contact tracing as well if you become ill. I think it's important to be particularly mindful, so that period after racing or after a really hard training session, we know that athletes' immune system is more susceptible to illness. So again, it's just being really mindful of all those good kind of hygienic practices immediately after races, when you're that much more susceptible. And again, something that I want to at some point give some more information on, but any athlete that develops COVID-19 should be advised to strictly rest until their symptoms have completely gone. And they should seek further medical advice then about returning to training safely, and any kind of screening that they might need before doing that. So yeah, that's it. Thanks very much for listening. And yeah, as Iris said, if you've got any questions, please either speak up or put them in the chat. And a quick little poster on wearing masks that I quite like.